What is up, everyone? Welcome back to another episode with Medicine with AUNO. So today we are going into a new series called The Patient with Back Pain. And basically we're going to be looking at various presentations of back pain and trying to figure out how to diagnose these to get patients healed up. So anyways, again, if you haven't yet, smash that right there. And let's get going. So, overview to the series, and we're going to talk about the first one today. I think y'all can hear the frog in the background, kind of annoying. Hopefully future videos won't be like that, okay, so don't worry. But it's nice outside. So, we'll talk about non-specific mechanical back pain, which will include muscle strain, degenerative back diseases, disc herniation without nerve root compression, spondylolisthesis, spondylolysis, and spondylosis, which is also spinal osteoarthritis. We'll also have video on spinal stenosis. Here we can see the ligamentum flavum ligament can become hypertrophied and cause narrowing of the spinal canal. Disc herniation with nerve root compression. Here's an example on MRI. Here is an example here of an epidural abscess. So these are infectious or inflammatory causes. And you can see the spinal cord is here in darker gray, and then behind it more posterior. Well, we can see CSF in the brighter signal here, posterior and in front. But then right here you see this, we'll call it an intermediate signal. If we want to call this dark and light, this will be in the middle of those two. And this is an epidural abscess, pus collection back there. Not a good situation, so we'll discuss those. Vertebral metastases, here we can see metastatic lesion in the thoracic vertebral body. And non-orthopedic causes, referred pain. Who knows what this is? This is a massive aneurysm. And it appears the aneurysm has probably already ruptured and has formed a, whatever. We'll discuss those, right? I'm not there yet, so we'll figure it out together. So today's talk is on back strain, muscle strain. So what is the difference between a back strain and a back sprain? So back strain is muscle tendon injury. Let me fix our, never mind, hopefully this will be okay, but you can't see my pointer too well. You know what, we're going to have to fix this. Let me fix my pointer here. Let's get the magnifier going. Okay, and we'll minimize this. Alright, so now y'all can see where I'm pointing. So, sprain is ligaments, strain is the muscles or tendons. And we can see that down here. You know, just take a look at this, you know, muscle is a strain, ligament, sprain, also tendon can be a strain. Just, you know, words, you know, definitions. But, muscles, bundles of stretchy fibers, connected tissue, tendons, fibers, connected tissue, ligaments, elastic strings, fibers, connected wear, connected to your bones by tendons, tendons attach bones to muscles, ligaments attach bones to bones, and yeah, so you all get the point, right? Pathophysiology of a muscle strain. So cause depends on the specific condition, right? And it's often you don't know what caused it, right? And injured muscles or tendons that support the back become pulled or twisted, causing damage. You can see this can be chronic, sustained trauma, wear of back muscles, or it can be acute, just a single event of overstressing back muscles, as seen in athletes or lifting. So this is like sort of a correct way to lift. Its box could be between the knees. This is not good on your spine, putting all that pressure on the spine, bending over to lift that. So that can lead to muscle strain. So yeah, most common in the low back as it supports the weight of your upper body and it's used for moving, twisting, bending motions. And lumbar strain can occur when muscle fibers are stretched to an excessive degree. You see that here, muscle fiber here got kind of torn there. And we can see these muscles here in the back, right? The paraspinal muscles, you know, your erector muscles. Iliocostalis, longissimus, and spinalis muscles. You can see just all these. I mean, there's a lot. And it can get kind of complicated looking at all these. These are some more basic pictures here. Rector, this one has the 3 different muscles in it. Latissimus, dorsi, trapezius, rhomboids, oblique. So all these things can get strained and injured. So history taking, you got your patient. You want to find out how long this has been going on. And they might have an acute issue where they just happened injury, be recurrent issues in the past they've had things happen. And they could be in chronic pain that's been going on for a while. Usually the onset's pretty sudden. They know they injured it. And these muscle strains can resolve in a few days to about 6 weeks with proper care. And you can have tenderness in the paraspinal muscles, a sore back, severe stiffness with muscle spasm, no hot or electric shock pains, right? Because these will be more neuropathic pains, and we'll discuss those that can be seen in like disc herniations and spinal stenosis. But yeah, you're going to have some just diffuse soreness in the lower back, usually localized in low back, diffuse though, bilateral, occasionally in the buttock, hips. It does not go down your legs like you see in sciatica or these other conditions we'll discuss in future lectures. Aggravating factors, it worsens with activity. Frog, can you please be quiet? I'm trying to record a lecture here. Anyways, aggravating factors, worsens with activity. Relieving factors, rest, ice, NSAIDs, right? Associated symptoms, none really. No fevers, nothing to like constitutional symptoms. Pertinent risk factors, older age, heavy lifting, improper lifting technique as we saw earlier, previous back injury, high contact sports. And then we always want to ask the patient, is there anything that you are specifically concerned about with your symptoms or what you're worried this might be from? Involve them in their health care because it's their body, right? And prior evaluations, have they seen other doctors for this? So you're going to examine your patient and you're going to note some tenderness or spasm over paraspinal muscles. Again, you can see these right here, lateral to the spine. You have your extensors, erector spine. You have your deep extensors, superficial deep. So yeah. Exam findings. Again, they can have tenderness, but you're not going to see anything like vertebral tenderness. So the spinous processes, not going to have tenderness there. You're not going to see fevers or chills or night sweats. You're not going to see any weakness in the limbs or sciatica or radiating pain. You can note some tenderness, spasm. As we said, inspection of the back is normal. Range of motion might be decreased. And labs will be normal. Imaging will usually be normal. You really don't need to image these patients if they get better within 6 weeks, given there's no red flag symptoms. But yeah, just rest it, ice it, some Advil or something. These patients should be fine in a few weeks. So that is the end of this video, y'all. It was a quick one. So come back for the next one. Thank y'all for watching. I'm out. It doesn't have the same effect, y'all, as my other videos because you still see the screen, right? Because I share my screen. I guess if I did this, it would have a better effect. All right, y'all, have a great week. Hope everyone go out there and make someone's day better. And we're out.